My name is Giar, and today I will be informing you on type 1 diabetes. As I am a type 1 diabetic, I will discuss the symptoms, complications, and successful treatment of this disease. Type 1 diabetes is a condition that occurs when the pancreas produces little to no insulin, which is a hormone that allows cells to process glucose. Because of the lack of insulin, your body cannot process sugar. The sugar builds up in your bloodstream, which causes your blood to become acidic and can lead to ketoacidosis, a coma, and in some cases, death. Type 1 diabetes used to be known as juvenile diabetes because it is most common in children, but recent research has shown it can develop at any age. As stated by MayoClinic.org, different factors including genetics and some viruses may contribute to type 1 diabetes. Some symptoms of type 1 diabetes include increased thirst, frequent urination, fatigue, weight loss, nausea, blurry vision, and mood changes. As stated on diabetesresearch.org, type 1 diabetes is not caused by a person's diet or lifestyle. Your immune system attacks beta cells in the pancreas. Eventually, the cells die, and the pancreas can no longer produce insulin. If not properly treated, type 1 diabetes can lead to complications such as nerve damage of the eyes and feet and damage to internal organs such as the heart and kidneys. Type 1 diabetes is treated successfully with insulin given through a pump or injection. Whenever a person with type 1 diabetes eats carbohydrates, they give themselves insulin because their body does not produce any. I'm going to show you an insulin pen. This is a pen needle on top of it, and I use this instead of a pump to give myself insulin. Monitoring blood sugar numbers to keep them in the normal range is a key factor in reducing complications in people with type 1 diabetes. A general target range for blood sugar in a person with type 1 diabetes is 70 to 180, but this number varies slightly from person to person. Blood sugar can be read with a glucose monitor by taking a small sample of blood to a test strip inserted in the glucose monitor. Blood sugar can also be read by blood glucose sensors using a glucose monitor or even an iPhone. This is a blood glucose monitor, and this is a test strip. I'm going to insert the test strip in the blood glucose monitor, and then I'm going to clean my finger and poke it to get blood and put it on the test strip so it can read my blood sugar. To conclude, I will be checking my blood sugar and asking the audience if the reading is high, low, or in range, and whether the reading indicates an insulin correction dose is needed because of high reading, a snack should be eaten because of a low reading, or if no action is needed because the blood glucose reading is within an acceptable range of 70 to 180. I'll be using my iPhone and the sensor on my arm to check my blood sugar. Based on this reading, is my blood sugar high, low, or within normal range?
High.
It is high.
Good, and I'm going to take, it's high, and I'm going to take a correction dose to lower it. Thank you for listening to my speech.